Clara Williams is a professional ballerina dancer for the New York City Ballet. She is 5 foot 8 inches tall and she weighs 120 pounds. Her initial injury began on July 2nd, 2017, while she was in rehearsal. She reported slipping on a slick spot on the dance floor while attempting to hold a leg extension pose. She reported feeling a twinge of pain in the anterior medial hip and reported that she pushed through her pain but continued to dance with an aching hip for the following 2 months. As her symptoms progressed, she began to lose hip range of motion in external rotation, adduction, and hip flexion. She also complained of pain with any prolonged standing, walking, and was unable to close fifth position. Despite the rest, rehabilitation, massage, acupuncture, and cortisone injections, she was unable to resolve her symptoms. She consulted with a surgeon, and an MRI confirmed that she had a right hip anterior labral tear, bone spurs, and mild arthritis. She was scheduled for surgery on September 5th, 2017, for an anterior labral repair, debridement of the bone spurs, and smoothing of the bony surface of the femur to address the arthritis. Establishing rehabilitation goals for professional ballerinas can be difficult, especially due to the unique physiological demands of the activity. It is a very unique and competitive environment that places extreme amounts of stress physically and mentally. The dancer must be prepared to dance a grueling 8 to 12 hours per day. This requires the dancer to have high levels of both aerobic and aerobic capacity. The dancer's anaerobic fitness level allows them to execute faster and powerful dance movements, while the aerobic fitness level allows them to continue dancing for long periods of time. Each system plays a significant role on the stamina of the dancer, which are equally utilized. Having a strong lower extremity allows the dancer to execute complex movements such as lifts and leaps. It can also assist with increased balance and postural control. Being a dancer requires a high level of range of motion and flexibility that far surpass other athletes, especially in the joints of the hip, spine, and ankle. This increased motion allows them to adequately perform the movements and skills within the routine. It's important to remember that these are not just athletes but artists as well. They have to perform with power and strength as well as grace, agility, and an extreme level of control. Ballerinas put stress on their bodies due to the extreme motion and the length of time that stress is put on the body. Hip injuries occur due to the extreme external rotation at the hip to complete dance motions. The extreme rotation can cause the head of the femur to move forward in the acetabulum, which can cause damage to the joint. The professional ballerina must also have a particular body type. The typical dancer body is very thin and petite. There are several reasons for this occurrence, first being the material aspect of ballet. Dancers are expected to look this way in order to look as aesthetic as possible while they're on stage. Another reason is due to the physical demands of their sport. They are expected to dance 8 to 12 hours per day in order to perfect their skills and memorize their choreography. This amount of physical fitness helps to maintain that body type. Lastly, having a slight body is easier for them to perform certain movements, perform for longer periods of time with less pain, and they can be easily lifted by a partner. Body image can be a difficult obstacle for a dancer to maintain, especially if they are injured. Phase 1 rehabilitation will be the first 2 weeks post-operative. The goal is to protect the incision by using non-adhesive gauze dressing to avoid stress by limiting hip flexion past 90 degrees and internal and external rotation. We will also be reducing inflammation through cryotherapy and compression and using girth measurements to measure at the first week of rehabilitation and the second week of rehabilitation. Our goal is to promote tissue healing by keeping the site clean to prevent infection, and manual therapy to increase blood circulation and increase nutrient and oxygen uptake. We're also allowing the patient to rest after the surgery by giving them low-intensity home exercise programs. This rest will also help increase the amount of tissue healing that is occurring post-op. General wound care is an important part of Phase 1. The incision is covered with a sealed dressing for 48 hours, and the stitches are covered with a large Band-Aid to keep clean, dry, and protected until stitches are removed in the office during the follow-up evaluation. During Phase 1, the patient is prescribed 3 medications. She is to take aspirin twice a day, 325 milligrams to prevent blood clots, Celebrex twice a day, 200 milligrams to reduce inflammation, and Percocet 1 to 2 tablets every day for 4 to 6 hours for pain. The patient will wear a hip brace during the day and while sleeping. The only time she will remove this brace is when showering, and the brace is used for reducing any unwanted motion and to limit the positions that could re-injure the hip post-op. During Phase 1, we are avoiding hip flexion past 90 degrees, internal and external rotation, and high-impact motions such as running and jumping. Today we're going to start with the Phase 1 home exercise program for our patient. So the first exercise that we're going to have them do is a glute activation exercise. So for this we're going to do a glute bridge. So I'm going to have you bend your knees for me. And what I want you to do is keep your core nice and tight so that it's squeezing into the table and you can feel it contract. And then what I'd like for you to do is to bridge your back up off the table, lifting it up, and then holding it there for 2 seconds, and then bringing it back down. So make sure you're really squeezing those glutes together when you're pulling up, and then slowly coming back down. So in this way, we're activating the glutes, we're activating the core, and we're starting the first process of strengthening those core muscle groups. And they will do this 10 times as they're able, and then relax. And then if they're able to, do that 2 more times. The next exercise I'm going to show is passive circumduction flexion at 30 and 70 degrees. So I'm going to start with the passive circumduction at 30. So we're going to take the leg 30 degrees. We're going to go 3 minutes in clockwise. Slow circles. And then we're going to do 3 minutes counterclockwise. Have them relax. Then we're going to bring them up to 70 degrees. Typically you'd have them on a lower table, in fact, so that I have better body awareness. I'm going to grab the stool. Up to about 70 degrees. So we're not hitting that 90, but we are going to get to 70. So at our 70 degrees, again, we're going to go 3 minutes clockwise. Counterclockwise, and then come back up and relax. And then the last one we're going to do is passive oscillations. And oscillations are just a way to get the muscles after surgery just to relax and not to be as tense, so that we're able to hit all of the muscle groups that we can without their muscles inhibiting those motions. So just a little bit of distraction, and then do my oscillations. During Phase 1, the patient will be using crutches for stabilization and support. They will be performing a 4-point gait, which means they will be partial weight bearing during this time. The goal of manual therapy is to target the iliopsoas, the IT band, the TFL, the adductors and the gluteus medius to loosen the tissues surrounding the joint, allow for greater ranges of motion, and to reduce any trigger points that may be within the muscle tissue. During phase 2, we expect the patient to have normal ambulation without pain or the assistance of crutches, to have pain-free range of motion within normal limits, and hip flexion, to progress the home exercise program so that they have an increase in the intensity and the amount of times that they perform each exercise, and to continue with muscle education and reactivation.